Oh, I'm having headache. Oh, my head hurts. I feel my blood pressure is high. Let me quickly go and check it. You check it is on a high side and you decide to take your antihypertensive medication. So the big question is, do I need to take my antihypertensive medication when my blood pressure is already normal? Or do I have to wait till I see the signs of hypertension before I take my antihypertensive medication? So that was the question I got on my comment section, and I decided to take it on this particular video. Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today I'm going to be talking about antihypertensive medication, when you should take it, when you should stop, and how you should go about it. But before we go into details into this class, if you are new on our YouTube channel, please click on that subscribe button, turn on the notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go there. Welcome back. Like I earlier said, today I'm going to be talking about antihypertensive medication and when to stop your antihypertensive medication. Before I came outside to share this video, I have already called my mom to educate her on this because she is antihypertensive, and I grew up seeing her like checking her blood pressure only when she has the signs and symptoms, which is a severe headache. Whenever she feels she's having headache, then the next thing is that, oh, I think my blood pressure is high, I need to check my blood pressure. Then after checking, she finds out it's high. Doesn't know, oh, I have adome, I need to take my antihypertensive medication. So that was how I've seen her for a very long time doing this over and over again. See, I saw this question and I watched a video from Dr. Jean Caudle, yeah, that's her name. Then I decided to make this video and also educate my followers. So if you have a parent that's hypertensive, I think you should not skip this video. When we say hypertension, we simply mean there's an increase in the blood pressure. For those that don't know what hypertension is talking about, is an increase in blood pressure. We all know that blood vessels, you can see blood vessels, blood flowing through. So when it's not using more force than expected to flow through the blood vessels, it's using more force, that increases the blood pressure. That's why you say, oh, this person has a high blood pressure. And most times, most people with hypertension, they are asymptomatic. That's the signs and symptoms are not obvious. They don't even know they have it until they go to the doctor and check their blood pressure. That is why it's advisable for you to check your blood pressure regularly, even if you are not hypertensive. It's advisable you visit the doctor, check your blood pressure to know the state. Because some people, you hear people dying overnight, sleeping and dying. One of the cause could be that blood pressure that was not checked. And if blood pressure is checked and you know you have blood pressure and you are not managing it, it can lead to a lot of things. You know or you don't know. If blood pressure is not managed properly, it can lead to stroke. It can lead to stroke. It can lead to kidney problems. It can lead to death if care is not taken. That's when you see people dying overnight. So that is why it's advisable you always check your blood pressure. Now that takes me back to the question while I am here today. Should I stop my antihypertensive medication when my blood pressure is normal? The answer to that question is no. You don't have to stop your antihypertensive medication when you see your blood pressure is normal. Your blood pressure is normal, is within that range because you have been taking the antihypertensive medication. There's a possibility when you stop, it's going to skyrocket. It's going to go up again. So it's advisable you don't stop your antihypertensive medication when your blood pressure is normal. And if you feel you want to stop, it's advisable you also speak with your doctor and discuss some other options with your doctor. One thing that can make you stop this antihypertensive medication if the underlying cause, what is causing that blood pressure, has been sorted out. For those that are obese, if obesity or excess fat was the cause of the hypertension, if you reduce your weight, now you now have a healthy weight, you can discuss an option and the blood pressure medications can be stopped. So if what is causing it has been removed and you know it's no longer there, the possibility of getting this hypertension is no longer there, then you can discuss the options with your doctor and the doctor can advise you, oh, you can go ahead and stop it. But on your own, it is not advisable you stop taking your blood pressure medication even when you check and it is normal. So you just have to follow the normal doctor's prescription and go ahead with your daily activities. Then another question was, should I take my antihypertensive only when the signs and symptoms surface? The answer is no. You see the signs, you're having headache or not, take that medications. Whether you're having headache or not, whether you're seeing the usual signs, you're having hot flashes or not, take your antihypertensive medication and at least have a blood pressure cuff in your hands and do the check regularly. Like I earlier said, if you want to stop for any reason, it's advisable you speak with your doctor. Those blood pressure medications, your blood pressure is normal because you are taking those medications. You get, there are some people that their blood pressure is normal, but they have some genetic causes that even if they change their lifestyle, they have reduction in weight, they change their feeding, there's low cholesterol in their oil and things like that, they will continuously have high blood pressure. So that is why it is important when you have that thought, you feel, oh, I've been managing my blood pressure for a very long period of time and now it's low, I have to stop. Please speak with your doctor. Please, because there are a lot of complications associated with untreated or poorly managed hypertension. All right, so don't just stop on your own. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.